In a previous video, we talked about lifestyle modifications for GERD. In this video, we will explore medical options for treatment of GERD. The mainstay for medical therapy are acid blockers, and there are two main types: histamine 2 receptor blockers, commonly called H2 blockers, and the other main type are proton pump inhibitors, commonly referred to as PPIs. PPIs are considered the stronger of the two. There are also antacids, which aren't as effective, but I will mention these briefly as well. Now, different physicians customize which of these acid blockers to prescribe you based on your personal symptoms. The medications we will go over in this video all work by reducing acid exposure in your esophagus, but do not prevent the action of reflux itself. Now, let's talk a little bit more about acid blockers. Histamine 2 receptor blockers, or H2 blockers, work by blocking certain receptors in certain cells in your stomach that cause them to produce less acid. With less acid in your stomach, there's less irritation of the esophagus when stomach acid does reflux up from the stomach into esophagus. In patients whose symptoms are relatively minor, meaning less than 2 episodes of reflux a week, and who are already trying or have failed lifestyle modifications, it's common to see H2 blockers used. Some common H2 blockers include famotidine, whose market name is Pepcid, ranitidine, whose market name is Zantac, nizatidine, whose market name is Axid, cimetidine, whose market name is Tagamet. H2 blockers are commonly prescribed twice a day, once in the morning and again either before dinner or before bedtime. They work best if they're taken 30 minutes before meals. So for example, taking your H2 blocker 30 minutes before breakfast and 30 minutes before dinner is an appropriate regimen. The reason it's best to take your acid blocker 30 minutes before meals is that doing so prevents your stomach cells from making stomach acid when you do eat. H2 blockers are generally pretty well tolerated, but some common side effects can include headaches, dizziness, diarrhea, nausea, and rashes. More extreme side effects are very rare. Of note, H2 blockers tend to become less effective if you take them every day and for an extended period of time. Proton pump inhibitors, or PPIs, are the strongest acid blockers out there, and they act in a similar way as H2 blockers. They just block a different receptor in different cells of the stomach. This also leads to less acid production, which leads to less irritation of the esophagus when reflux from the stomach does reach the esophagus. Proton pump inhibitors are generally started in individuals with severe symptoms of GERD who may have already failed lifestyle modifications and H2 blockers. Some common PPIs include omeprazole, whose market name is Prilosec, lansoprazole, whose market name is Prevacid, esomeprazole, whose market name is Nexium, rabeprazole, whose market name is Acifex, and pantoprazole, whose market name is Protonix. These medications are generally taken daily. Like H2 blockers, PPIs should be taken 30 minutes before meals, generally breakfast. They are also generally well tolerated like H2 blockers, with some common side effects including headaches, dizziness, nausea, diarrhea, and rash. Extreme side effects are also rare. There is some concern for an increased risk of fractures and a severe diarrheal illness in individuals who take PPI on a long-term basis. If you begin to experience severe diarrhea, alert your doctor right away. Lastly, I do want to touch briefly on antacids. Antacids are usually some combination of calcium, aluminum, and magnesium salts. They are available over the counter in stores, and there are numerous different types and combinations of these. Some common ones include Tums, Maalox, and Mylanta. These work by neutralizing the stomach acid that is in your stomach, and I'm going to represent this by replacing some of the green lines here with blue lines to show that stomach acid has been neutralized. Neutralizing your stomach acid does provide some relief from GERD. However, because you are just neutralizing the acid and not preventing acid production, as with H2 blockers and PPIs, this is just a very temporary solution and not the best way to manage your GERD long term. Common side effects include diarrhea, constipation, and nausea. The danger with antacids is that if you take them too often, the salts in the antacids build up and cause a variety of symptoms. If you find that you're taking antacids several times a day consistently, you should speak with your physician about other options like H2 blockers or PPIs. Although not strictly an antacid, your doctor may also prescribe a medication called sucralfate. It binds to the esophageal lining, creating a physical barrier that prevents acid injury. Just like antacids, there are better long-term ways to treat GERD. In this video, we have talked about medications to help control your symptoms of GERD. These include histamine 2 receptor blockers or H2 blockers, proton pump inhibitors or PPIs, and lastly, antacids. We will explore surgical options for GERD management in future videos.